organized by Father Muller Homoeopathic Medical College. Over the past 1 week, we have heard many experienced homeopaths sharing their clinical experience here. This week also, there are many interesting presentations lined up. I also extend a warm welcome to our administrator, Reverend Father Roshan Krasta, our principal, Dr. Shiva Prasad K., Vice Principal, Dr. E.S.J. Prabhukiran, the convener of webinar series, Dr. Dheeraj Fernandez, and all our dear delegates. Today's session is by Dr. Siju Thomas, and the topic is Attention Please. The moderator of the session is Dr. E.S.J. Prabhukiran, Vice Principal and Head of Department of Anatomy, Father Muller Homoeopathic Medical College. Now, I kindly request Dr. Prabhukiran to take over the session and introduce the speaker. Over to you, sir.
Good evening to all. It's nice to be back today for another webinar as part of the ProVision series. Today's session is interestingly titled, Attention Please. It evokes curiosity and promises to spread happiness to all of us as we go through the session. Dr. Siju Thomas Thottapilli, today's resource person, is an alumnus of 6th batch of Father Muller's Homoeopathic Medical College. He is a practicing homeopathic consultant specialized in behavior and learning disorders since 23 years. He is practicing at Thottapilli Homeopathic Center, Chalakudi, Aditya Institute of Homeopathic Medical Sciences, Cochin, and Wellcare Homeopathic Clinic, Todupura in Idukki district of Kerala. Having completed his PHMS from Father Muller's Homeopathic Medical College, Mangalore, Dr. Siju Thomas pursued post-graduation in Value Education and Spirituality from Annamalai University, Tamil Nadu. He is also a postgraduate in Hospital Administration from Indian Institute of Hospital Administration and completed a certificate course in Special Education Learning Disabilities from Santhwana Institute of Counseling and Psychotherapy, Ernakulam, Kerala. A soft skill development trainer since 18 years, Dr. Siju Thomas has expertise in corporate training, parents and teachers training. He is also well known as parents consultant, happiness coach, value consultant, motivational corporate trainer, lifestyle management expert, stress management trainer. Dr. Siju Thomas is resource person for Macmillan Publishers. He is author of a book, New Generation Parenting for Parents. Member of JCI, YMCA, Lions Club, Cosmos Club, and the Institution of Homeopaths Kerala, Dr. Siju was awarded Outstanding Zone President of JCI India in the year 2007. Dr. Siju has organized workshops on new generation parenting, giving special emphasis on family relations, values, behavior and learning disorders, and present and at more than 1,000 institutions. He also conducted workshops for teachers on professional excellence, teachers to counselor, experiential teaching and learning outcomes, teacher leader and quick learning in more than 750 schools and professional colleges. During my brief interaction with him, I understand him to be well organized and clear in his executions. Hope we all experience fruitful session today. I invite you, Dr. Siju Thomas, to make us part of your mission through his deliberations today. Over to you, Dr. Siju Thomas.
Thank you, Dr. Prabhukiran, sir. Thank you. Am I audible?
Yes.
Okay.
Yes.
Yes, sir. Yes, sir.
Okay, I'll go for screen sharing first of all. We can see the screen, right? Dr. Dheeraj, can you see the screen? Prabhukaran, sir?
Sir, yes, sir.
Yes,
Yeah,
yes.
yeah, we can see the screen, sir.
Okay, let me start.
Yes.
Yes. So, most respected principal of Father Muller's Medical College, Dr. Shiv Prasad, sir. And I'm really happy to be here with Father Muller's again and our most beloved Dr. Srinath Rao sir. He called me today evening to invite me to be here with Father Muller's again once more. And this was really nostalgic to see everything about Father Muller's again in this beautiful evening. Dr. Prabhu Kiran sir introduced me in a fantastic way. It took so much time. And thank you, sir, for introducing me in a fantastic way. Thank you, sir.
Okay.
The person who invited me for this fabulous function and who made this mission possible, my good friend, Dr. Girish Navada, and the person who was really working behind me, Dr. Dheeraj, and all the alumni, all my seniors, all the juniors, and all the people of Father Muller's. Thanks to all. First of all, I'm really proud to be a Mullerian, and I'm really proud to be here again with Father Muller's Homeopathic Medical College to share some of my insights about a beautiful subject and my favorite subject, attention please. And with all the blessings from all my seniors, all the teachers of Father Muller's Homeopathic Medical College, let me start this small session before you. My dear friends, attention please. This session starts like this, attention please. I don't want to make this session a one-sided session. I want to make this an interactive one. To make this session an interactive one, I would like to request each and everyone, I think more than 400 participants are participating in this beautiful session. Lots of doctors, lots of students, lots of postgraduates are there participating in this beautiful program. You please use your chat box initially. I'll be asking a few questions. Don't worry, I'm not going to ask you something about organ. I'm not going to ask you something about materia medica. It's all very simple question. To make it more interesting, dear friends, I'm going to start with a simple question from general knowledge. And the question is going to start like this. I'm going to introduce certain personalities before you. And you have to tell the names of that famous personalities. And the first personality comes like this. And it goes like this. Definitely a person who had some kind of, you can read all the stuff. A person had some difficulty during his studies. At one point, he became very flustered by the sheer magnitude of the challenges faced at school. As a result of his experience, he was inspired to launch the On It campaign. And he's the lead singer of the critically acclaimed band Maroon 5. He asserts that all through his life he had to deal with this condition. And dear friends, he has helped and made a lasting mark on the contemporary music scene. You can see, you can hear that beautiful music right now. As a principal songwriter and also plays a guitar for the group. My question is very simple, and I'm already getting the beautiful answers there. And the first person to answer that beautiful question was Maria Sunny. Please put your hands together for that beautiful answer, and that is Adam Levin. Wonderful answer. I think everyone are sitting at their on couch at their house. Definitely, I think so many people deserve a round of applause like Maria Sunny, Dr. Rachel Norona, and lots of names are coming up. Ansi and Merlin Friedman, Ambiga and Dr. Sajid Lal. Lots of people are coming up with beautiful answers like Adam Levin. You can put your hands together for the beautiful answers. And the person behind Maroon 5, Adam Levin. Great. And we have awesome participants today. Let me go with the second question goes like this. And he had lots of strength and the people didn't accept it. I knew I had strength that other people didn't have. And my parents reminded me of them when my teachers didn't see them. Now, he's one of the most successful CEOs in the airline industry. Founded 5 commercial airlines: JetBlue, Airways, Azul Brazilian Airlines, Maurice Air, WestJet, Breeze Airways, 45% of TAP Air Portugal too. Don't go for Googling. Father of 10 children with his former wife went for a multi-million-dollar settlement too. Any answers from your side? Please put your answers there in chat box. I didn't get any answers till now. Let me have your answers, beautiful answers. A person who went for 5 commercial airlines. I'm getting some answers. Yeah, that's it. Wonderful. We have beautiful answer from Robin Bullock. Robin, and that is the answer is here. JetBlue founder and CEO David Neeleman. We have great, awesome participants here. A person who's really flying high, and that is the answer is David Neeleman, and the person who answered is Robin. And put your hands together for Robin with the great answer, and another so many answers from Dr. Ashima, and great answer Dr. Sharij, and all these people are coming with beautiful answer. David Neeleman, beautiful, awesome participants today. We are going to the third question. Third question is very simple, and here is that answer, that question. And question is, he always going with his beautiful words like this. A very simple, humble personality. He always says about him like this: I had big ears, I was scrawny, I got picked on a lot. And in his book, Beneath the Surface, My Story, he says he spoke too quickly and wouldn't look people in the eye when they talked to him. Holds a record for winning the most Olympic events in the history. A famed swimmer has 28 medals to his name, including 23 gold medals. And one of the driving sources is always the wins comes from an unlikely source. And the answer comes from Maria Sunny. And that is Michael Phelps. And dear friends, please put your hands together for again to Maria Sunny, Mahesh Jadhav, and see Michael Phelps is the answer. And dear friends, we are going for the fourth question. Is again another very simple question. And this question goes like this: a person, he wrote lots of exams, but again, his friend who was studying with him, he got the friend passed. I failed in some subject in exam, but my friend passed in exam. Now he's an engineer in an organization, and I am the CEO of it. He's a millionaire at 626 years as a Harvard dropout. Already answers are there on the greatest charitable organization in the world. And the answer is there from lots of people, and the answer is Bill Gates. My dear friends, I introduced so many people before you. David Neeleman, I introduced Bill Gates, I introduced Michael Phelps, and I introduced a great singer also, Adam Levine. What is so common with all these people? Put your answers in the chat box. What is so common with all these people? I'm getting some answers, achievers. I'm getting some answers from Dr. G. Rajchandra, autistic before artistic, and famous people. Difficulty in studies from Meghna Rao, never fails to try. Autism people, ADHD people from Saida, successful people, learning disabilities, successful people from Fasia, determined people from Dr. Sharij, and lots of answers. And what is that? What is so common? What is so common with all these people? What is so common with all the people? Hard workers, and so many answers. My dear friends, I'm very happy to see that we have lots of amazing participants today. 450 participants, and all are amazing participants. My dear friends, history always, almost all these people have ADHD. And you may be thinking that, what is that ADHD? Yeah, we are getting lots of answers. They want something to achieve, determination people, thinking people, they believe in themselves, they have self-confidence people, hardworking, dedicated people, background people, confident people, out-of-box thinking people, and ADHD people. And what is that ADHD? Can you put what is ADHD over there in the chat box? What is that ADHD? Any answers? I know lots of students are there participating in this beautiful program. What is ADHD? I know lots of answers, but I want to put like here, amazing, dynamic, happy dudes over here. Okay, I don't want to misdirect you, but I would like to call as amazing over here. But I know the history always says that these are amazing people. These are always dynamic people. These are always happy. They are always wonderful, good friends. But this, if the history always says that all these successful people, what is so common with all these people? People always say that they were having some kind of a problem called attention deficit hyperactivity disorder. But earlier I told you that they are all amazing, dynamic, happy dudes because of one reason. to our clinic with attention deficit hyperactivity disorders, as a doctor, as we have lots of junior doctors or just started practice in their clinic, how you should be in your clinic. As we have this kind of people coming to your clinic, how you should be, the doctor should be. As a doctor in the clinic, as we are getting attention deficient or deficit people coming to your clinic, one of the most important thing is always the doctor should be highly attentive. As you are getting a person who is coming into your clinic, attention deficit hyperactive, they are all hyperactive, and the doctor should not be hyperactive. The doctor should be always calm and relaxed. The third thing is always they are impulsive people, and the doctor should be highly thoughtful before diagnosing an ADHD because of so many reasons. I'll come to that point secondly. But how you should be, the first thing and most important thing is always the doctor should be highly attentive. The doctor should be highly relaxed with the most beautiful smile on your face. You should be highly calm and relaxed. You should be highly attentive and relaxed. And the third thing is always the doctor should be thoughtful before diagnosing, just because of few reasons. The reason is why? Because the few things can mimic the attention deficit hyperactivity disorder. Dear friends, attention deficit hyperactivity disorder, the parents may be bringing just because of the compulsion from the school or from the management side. From the management side, from the school management, or maybe the parents may be bringing those kids to, or the students from the school to your cabin. When they are coming to your cabin, they'll be coming with some kind of questions. At that time, you should be able to diagnose it. So few things can mimic ADHD. And what are the things which can mimic these kind of problems? Any answers? Can you put in your chat box what all things can mimic ADHD, attention deficit hyperactivity disorder? What all things can mimic ADHD? Please use your chat box. Please, my dear friends. Please go ahead. Yes, so many answers like autism. Yes, restlessness. Okay, what kind of restlessness? In what kind of conditions you get this kind of a mimicking habits? Where you get anxiety? Okay, fine. Yes, yeah, hypothyroidism. Beautiful answer. Yeah, beautiful answer. What kind of things which can mimic? Yeah, wonderful. ODD. Yes, opposition defiant disorders. Again, autism answers we are getting. Yes, troubled sleeping. Wow, wonderful answer from Dr. Kalera. Yes, sleeping disorders, bipolar disorder, wonderful answer. I'm not getting the name there. Okay, sleep apnea. Okay, sleeping disorders. Wow, great answers. Yes, and anything which can mimic. Any more answers from your side? What all? Yeah, some hearing, speech and hearing problems can mimic. Yes, hypomanic problems. Okay, conduct disorders, wonderful, beautiful answer. Yes, temper tantrums. Oh, is in some kind of, yeah, restlessness, mental aspect. Okay, inattention. Okay, I'll come to it. Okay, yeah, few more answers we are getting. Let me come back into the topic, and that is why and few things can mimic in this kind of a thing. And first of all, let me start with the number one thing is always, you might have seen this kind of energy drinks, the Monster energy drink, Red Bull, or the things like the Hell Rock, the Power Up adrenaline drinks like the Cloud9, or all kind of the drinks like the caffeine. The more caffeines can produce this kind of symptoms. And what kind of symptoms they always brings? Nervousness, jitterness, or this kind of restlessness can bring. So my dear friends, this kind of symptoms can bring when they are taking more caffeine in their life. The number one. Number two is always, even the cockroaches and ants and the cats and dogs and even the home flies won't eat this kind of things. And the human beings always go for it. And what is that? And we always continue to consume it. And that is what we call as aspartame. When we go for more of aspartames, it can create some kind of even the learning problems, headaches and seizures and migraines, and even irritable moods and anxiety, depression and insomnia. So more of aspartame, the toxic sweetness, and it can cause, or it can create this kind of the artificial symptoms, or the symptoms very close to of ADHD. The third thing, it is always the preservatives, more of sodium benzoate, and always this can create some kind of headaches, excitement, agitation, restlessness, irritability, anxiety, even the shortness of breath, and very close to what we call as ADHD. And coming to the fourth one of the most important thing, we already got answers, and that is the sleep deprivation. Actually, we should be able to get almost 6 hours of sleep or 7 hours of sleep every day. But some people, when they are getting sleep deprivation, there are every chances of getting this kind of restlessness, especially among the students. So sleep deprivation can lead to this kind of symptoms. I'm getting another few more answers that alcohol can create some kind of symptoms like this. Again, the substance abuse. And so my dear friends, sleep deprivation. And one of the most important thing right now, what I'm facing since the lockdown started on March 24th, we started with the lockdown. And since that time, I'm facing some kind of a thing, and that is about the stress. Even all the doctors, you might have got so many patients in your clinic, and soon after we started the lockdown on March 24th, we got lots of patients just because of the stress or anxiety. So just because of that, even in the newspaper, you might have read that lots of domestic violence happened at home, and this kind of a stress. Even the bullying siblings, even in the broken families, the stress always happened. Responding to the irrelevant reasons, even the stress happens. And to make it very short, more cortisol in blood leads to hyper, and again it leads to insomnia, again which leads to stress again. So stress can be another reason, again creating this kind of a symptoms. So stress, again the exam stress is one of the most important thing. And the exam stress, you all know that the boys how they respond and the girls how it responds. Dear friends, the boys becomes more hyper, but the girls lacks attention when they go for exam stress. So one of the most important thing is when they attend for the examinations, even they have that kind of a symptoms. We all know as doctors how the left brain works, the right brain works. If you go for some kind of a comparison, definitely we know the left brain always stands for, can you put that in the chat box? What for the left brain stands for, especially the left brain works for, any answers in the chat box? Left brain, shortly what it stands for, or the right brain what it stands for, can anyone? Left brain, we always say that it usually stands for mathematical thing or analytical working things or logical things, right answer there. And that is from Raga Sudha, we are getting a right answer, that logical thing. We always say logical or mathematical, or for the learning ability, we always use the left brain. And the right brain is always for the creativity aspects. So we can't compare some people. It is always when some people are always left, some people are always right. So we can compare some kind of students. And in some classrooms, some schools, definitely these people, these teachers, or some parents even, they compare their students, they compare their children just because of the left brain or the right brain. And even when they enter into their teen age, the attention becomes low, the impulsivity progress in in few teens. So in the new age teens, we always see this kind of a thing, the impulse progress. And that is why even during when we take the license in the bike and everything, when we go for the license, we always want the people to delay the taking of the license for the bike, because even the frontal lobe of the brain it becomes a mature or it becomes mature when it reaches into the maximum age of 20, or when it reaches to 25, it becomes highly mature. And that is why we always ask the people to go for the late ages to be mature. So attention becomes low and the impulsivity progress, and there are every chances of reaching into some kind of accidents if they start driving the vehicle at the lower ages. So my dear friends, even comparing to or concluding to each and everything, I want to add something, that is always when they go for the hyperactive kind of symptoms can come up in all this kind of problems. Coming to another greatest thing, somebody was rightly saying that it is always the drugs and alcohol and smoking, and nowadays the people are going to ganja and everything. My dear friends, it is always among adults being treated for alcohol and substance abuse, the rate of ADHD is about 25%. That is another thing. Child with ADHD starts abusing alcohol during their teenage years. In one study, 14% children aged 15 to 17 with ADHD had problems with alcohol abuse. My dear friends, let me tell you something, but if there are students who are using smoking, ganja, or drugs, whatever it is, it can mimic the symptoms of ADHD coming to your clinic. So let me make it more short, or to be precise. So many students are maybe coming out with this kind of symptoms, and there are every chance of mimicking ADHD when they are using all this kind of drugs. So most important thing is we have to differentiate whether they are using this kind of drugs or whether they are coming out with this kind of ADHD. So one of the most important thing, we keep this in our mind. Another, so many people were talking about the dyslexia and everything. And the dyslexia is always, you can read something here. This is what a dyslexic person often has to deal with just to read a book, and that is what it is written over there. Number one thing is always dysgraphia, which you can see. You can see some people are holding their pen, how they are holding a pen. And you can see how they are holding the pen and how you should hold a pen. The first thing is we should be able to see that all the students should hold their pen by keeping their pen on the middle finger, and they are supposed to grip that pen with the index finger and the thumb, and that's the right method. But you can see in the other pictures that how they are holding those pen, and this can create some kind of a dysgraphia thing, and this can create into dyslexia. I'm not going to that topic. That is another totally different topic. And some people may be getting dyscalculia. It is written there 2 into 2 is equal to 5. And dyscalculia people, we know 2 into 2 is equal to what is the answer. Certain chartered accountants will make that into 2 into 2 is equal to 5. That is chartered accountant's job. But rightly saying 2 into 2 is equal to 4, right? The thing is 75% of the learning disability. So even this can mimic this kind of problems of attention deficit activity. So this can mimic that is what I'm saying. Even you have to keep this in your mind. 75%. Okay, is it audible?
Yes.
Am I audible?
Yes, sir.
Am I audible? Okay, I'll come to the screen.
Fully rejoin ചെയ്തപ്പോൾ
I have to rejoin, I feel.
No, sir.
Screen. Okay, you can see the screen?
Yes, sir.
Can you see the screen?
Yeah.
Fine. So when we are using the digital media, more of the digital media, some kind of symptoms can come up like this, some hyperactivity or impulsivity. So this kind of, when you watch this, some kind of students or some kind of children may be coming to your clinic. And when they are coming to the clinic, definitely there are every chances of misguiding about this kind of symptoms. So another one of the most important thing you have to keep in your mind is always 21st century students are coming into the school. And definitely if they are entering into a 20th century classroom, what is going to happen? If you are filling up the students with knowledge, what is going to happen in the classroom? And that is one of the most important thing. So what you have to keep in our mind is always the filling up thing is over. The students are really genius. The only thing is we have to tap the energy of the students. And that is what the 21st century students are all eagerly waiting for. One of the most important finding, what you have to keep in our mind is, you might have read in the newspaper years back, there is a theory called hole in the wall. Dr. Sugata Mitra, chief scientist at NIT in 1999, carved a hole in the wall in a slum in Kalkaji at New Delhi. Through this hole, a freely accessible computer was put up for use. With no prior experience, the children learned to use the computer on their own. My dear friends, the children are really genius. Dear friends, let me tell you something. They independently learn a lot of things. But 21st century brain in a 20th century school, what is going to happen? 21st century schools are designed not to fill up students with the particular kinds of existing knowledge, but to increase the students' ability to learn independently with others and to produce the new knowledge. So the students are not ready to sit in the classroom idly. So we are going for a simple exercise right now. My dear friends, keep this in your mind. You might have studied something. We are going for the basics right now. To make it more interactive, let me ask you a few questions. While you were studying, A for what? Let me start from the basics. Let me take you to the LKG and UKG. A for what, B for what, C for what, D for what, E for what? Can you put in the chat box? A for apple, B for? I'm getting beautiful answers. B for ball, C for? Yeah, B for ball. I'm getting lots of answers. C for cat, and D for? And D for? And D for? D for dog. Wonderful answers. D for dog. Yeah, E for? E for? E for? Okay, D for dog. Okay, wonderful. E for elephant. Lots of elephants are coming. Okay, great. And F for? F for? Yeah, F for? Wow, wonderful. Yeah, that's it. Fish and fan, frog. Okay, wonderful. We have amazing participants today. Great, great. Okay, you can put your hands together for yourself. Beautiful answers, beautiful answers. Great. But my dear friends, as I told you earlier, we have 21st century students. We have 21st century students, and they have lots of things in their brain. As I told, hole in the wall theory, the students are different in 21st century. It is only the A is not changed. A is already Apple, but B is for Bluetooth, and C for chat, D for download, E for email, F for Facebook, G for Google, H for HP, I for iPhone. My dear friends, the world is changing, and that is what I want to tell you here. School induced, and that is the students are not ready to sit in the classroom. They don't want to sit idly, and just because of that reason, they are restless in the classroom. And when they are taken into your clinic, you have to diagnose whether it is school induced, just because it is the lack of the competency of teachers, or just because whether they couldn't influence the students to sit in the classroom. Is it happening? Whether restlessness is just because of that reason, or is it just because of their hyperactivity? So my dear friends, the world is changing, alphabets are changing, the world is changing. Another great reason, as somebody was rightly saying, another thing which can mimic is always oppositional defiant disorder. Definitely oppositional defiant disorder can develop some kind of a contact disorders. The studies have shown that about 30% of children with oppositional defiant disorder can develop some kind of a contact disorders also. So this may be their kind of aggressiveness, and that can lead into arrogance. So if they're becoming the arrogance, they are becoming more aggressive and arrogant in the classroom, they'll be brought into your clinic, and they'll be telling you they are highly arrogant, they are highly aggressive. And when they are brought into your clinic, they will be commenting that this guy is hyperactive. They'll be coming, or the parents will be coming with the diagnosis, and they'll be telling you this guy is hyperactive. Don't go with this kind of thing. So you have to diagnose whether it is ODD or a contact disorder. Another greatest thing is always ADHD is a lifelong condition, generally beginning before the 12. It tends to be, the bipolar tends to be late, and ADHD is a chronic thing. I am not reading the whole thing, before the age 12. While bipolar tends to be late, ADHD is chronic. But you can read the whole stuff. My dear friends, we should be able to differentiate between the bipolar disorders, and we should be able to differentiate between the bipolar and the ADHD. What kind of a difference makes when they are coming into the clinic, what kind of a changes is happening, what kind of, whether they are moving from we know what is happening with the mania or depression. So we are supposed to differentiate between all this kind of stuff. So we are not supposed to, we are supposed to differentiate between ADHD and bipolar. There are lots of things which are mimicking these conditions. And few of the things I want to highlight here is Tourette syndrome, because in Tourette syndrome, we may be seeing lots of tics and everything. So in Tourette syndrome also, there are every chance we may be going with the hyperactivity. Worms infestations, the students, the kids maybe, or the children may be really restless because of the worm infestations. Hypoglycemia also, the symptoms they may be coming with lots of restlessness symptoms. So the worms infestations, they may be showing with lots of problems. Hypoglycemia. Thyroid, somebody was commenting earlier, and that is about the thyroid, hypothyroid or hyperthyroid also, and we get lots of symptoms. Hearing or vision, earlier somebody was commenting about the hearing or vision problems. The lead or mercury poisoning, and even that we get some kind of a symptoms. Some kind of a brain disorders, when the brain is getting some kind of a problems, definitely even that kind of a symptoms happen. Iron deficiency, high vitamin intakes, early diabetes, cardiac problems can come out with some kind of this kind of a symptoms. Maybe their head injuries, definitely. Emotional problems can come out with this kind of a symptoms, and even in cancer or carcinomas. And post-traumatic stress disorders, genetic disorders like Turner's disorders or sickle cell anemia, even this kind of a symptoms may be there. Fetal alcoholic syndrome coming out with, because if the mother is taking lots of alcohol during pregnancy, or before that also, if the mother is always running behind alcohol, fetal alcohol syndrome may happen. So that can be another reason. Viral bacterial infections may be another reason. The senses problem, sensory integration dysfunction can happen. And another greatest thing is pediatric autoimmune neuropsychiatric disorders, like the Tourette syndrome again, or cognitive functions, or like fidgeting problems, or tics or OCD, obsessive compulsive disorders, any problem like this. So these kind of problems can mimic these conditions of hyperactivity. So my dear friends, all these conditions can mimic the hyperactivity. And the greatest thing, as a doctor, as a homeopathic doctor, we know the homeopathic doctors are all great observers. And just because we all studied from Father Muller's Homeopathic Medical College, we are great observers. We always observe the body language. Just because of this reason, my dear friends, we are the masters. And just because of that reason, I just want to tell you, kids are always kids. Kids being kids. They are always simply normal. Most of the time, they are easily excitable. Maybe because of their boards, lots of problems can cause difficulties with attention and behavior. Any child who is showing those difficulties deserves a thoughtful, thorough evaluation to be sure that they get the right diagnosis and the best treatment. So one of the most important thing I just want to tell you is, the most important thing is we have to diagnose it. And why the diagnosis is important? Because as I said earlier, the students are referred to us, especially to the doctors, from the management of the schools or the teachers. They may be asking the parents to take your child to a psychiatrist or a psychologist. And when the teacher or a management, when they are asking a parent to take their child to a psychologist or a psychiatrist, they will be shocked. As a parent, they will be shocked. And that is a great stigma, to take a child to a psychiatrist or a psychologist. So the parent who is coming to your clinic, they may be asking $1 million question, and that question is it true? That question is it true whether my child have ADHD? Because the student, the teacher, or the school management might have referred like this: you take your child to a psychiatrist or psychologist, and that is there in their mind. So most important thing is you have to answer it, is it true? So as a responsible person, as a doctor, as a homeopathic doctor, you should be able to answer for it. So why they are referring, why the school is referring this kind of a child to you? Maybe that child may be a problem child in the school. That child may be creating lots of problems in the school itself. A problem child, disturbing everyone, destroying so many things in the school, disturbing everyone, destroying many things in school. And he may be fighting with each and everyone in the classroom, and that may be one of the another reason, problem child in a school. Just because he is a problem child in a school, and just because he doesn't have the proper attention in the classroom, what is going to happen? What is going to happen here? Everybody knows, as a homeopathic doctor, everybody knows one thing: his performance will come down. And what is going to happen? School poor performance is going to happen. Marks is going to be down. His performance will come down. And when the school performance comes down, what is going to happen next? When the school performance comes down, definitely the pressure will be there. He will be like there in a pressure cooker. The pressure will be there from the school, pressure will be there from the family, and the marks are less, and there are every chances of getting poor self-esteem. You know what is self-esteem? When we lack in poor self-esteem, there are every chances of we moving to another direction of our life. When the self-esteem becomes low, we know what is going to happen. The self-respect also, we are going to lose the self-respect also. So when we lose our self-esteem and self-respect, most of the students, what is going to happen? They are going for substance abuse. When they go for substance abuse, there are every chances of misguiding their life into so many other things. Everybody knows it, every doctor knows it. So there are every chances of getting sleep problems. When they go for sleeping problems, they are totally disturbed. They go for the sleep problems, they go for substance abuse, then they land into risky behavior in their life. They go for the risky behaviors, and from there, definitely they go for the trouble interacting with their friends, and they lead into the relationship difficulties. When they land into the relationship difficulties, what is going to happen? They fight with each and everyone. They fight with their friends. They fight everywhere, in the ground where they play, where they travel, in the bus, in the train, wherever they are, they fight with each and everyone. So one of the most important thing is, when they grow up, what is going to happen? Even the 8th standard student or a 9th standard student, they will start driving the vehicles. Even if the father they may be having a bike or something, they will start driving a bike. They may create road accidents, they create injuries, and the worst will come to their life, and even they will lose their life. I know some students who created this kind of injuries and paralyzed one side and all. I know some people who lost their life. So my dear friends, this ADHD can lose their life. So my dear friends, one of the most important thing is always, it all started from a problem child in a school, and that is why the teachers are taking lots of responsibility, and they are sending these kind of the students to our cabin. So as a homeopath, that is a great responsibility. As an Indian citizen, as a citizen of this beautiful world, that is a great responsibility. We can do wonders, and we, the homeopaths, definitely can do miracles and magics in our clinic with our homeopathic sweet pills. So my dear friends, one of the most important thing is, we can change their attitudes. So what we have to keep in our mind is, if we don't treat these kids, what will happen? These people are going to, the untreated ADHD can lead to several emotional and physical complications. ADHD can lead to the crimes, and that is what I have written here. Lots of things can reach into their crimes, and that is what lots of researchers are pointing to. And the most prevalent thing is, always in jails also, they are creating some kind of problems. The most prevalent thing is almost among those in prisons also. The recent studies of adult prisoners have shown that not only in ADHD, the more prevalent among those in prisons, that in general population, but also that within the prisons, it is those with ADHD seems to cause the most trouble. 37% of men and 15% of women offenders with ADHD commit most violent acts, and high level of substance abuse among the prisoners. So my dear friends, you have to keep in our mind as, if we don't treat it, there are every chances of increasing the number of prisoners in the prison, and inside the prison, those are the people who are going to create the greatest problems there. So one of the most important thing is, if we want to create the people who are with lots of values, only the homeopaths can do some kind of wonders. And that is what history always says. And in the history, if you go to the history of ADHD says something like this. Sir George Frederick Still, a pediatrician, a child's physician who lived in the world from 1899 to 1837, who highlighted about ADHD years back, he started by saying like this: it is the lack of moral control. And that is what I stated here. We have to value our values. That is about lack of moral control. And in 1918, when there was a pandemic of influenza, at that time, he said like this, that was about minimal brain damage. When we progressed in the year 1950, we said that is happening because of the minimal brain dysfunction. And later we again progressed saying that it is called hyperactive child syndrome in the year 1960s. Later we again studied and researched in the almost in the year 1970s. People started saying that it is happening, the hyperactive is happening just because of the diet and hyperactive thing. And again in the DSM-3 of we started saying that it is happening just because of the attention is becoming low and attention deficit is happening. In the DSM-3 states it is more of attention deficit disorder. And in DSM-4 we started saying, the history says ADHD started into being. So one of the most important things we have to keep in our mind is it is always we started with lack of moral control and why it is happening. Everybody knows that even the reasons are questionable, but altogether we always say that these may be the reasons, these can be the reasons. We count down to the genetic factors, we go for the reasons. The bottom line can be the reasons of alcohol or smoking in pregnancy. We say the some kind of a trauma, we say that the premature birth, we say that some kind of a social economic culture and our lifestyle, low birth weight, anxiety or tension of mother, and some kind of genetic problems, as I stated earlier. So these can be the problem causes of the ADHD. And let us come to the diagnostic criteria. Everybody knows that DSM-5 and the ISD-10 criteria says that if 5 or more symptoms of attention and the hyperactivity or impulsivity, we always say that the ADHD is there. That is the diagnostic criteria for ADHD. Everybody knows that. So my dear Okay, am I audible? Hello, am I audible?
Yes, sir. Yes, sir.
So there's something in between. One sec. Okay, can you see that? Okay, can you see the screen? Hello?
Yes, sir. Yes, sir.
Okay, fine. Okay. So dear friends, you can see the screen, and in inattention you can see the screen, and you can read those. Make careless mistakes or lack attention to detail, and that is number one thing. Make careless mistakes or lacks attention to detail. And one thing we can understand from this kind of the kids is always there, even though lacks attention to detail, if you they go with the technology and everything, or if they go with the kinesthetic things, definitely they'll be very happy to sit with that and they will go to the details, but make careless mistakes. Difficulty sustaining the attention. and does not seem to listen when always they deviate to some other things and fails to follow through on tasks and instructions. And one of the most important thing is exhibits poor organizations and forgetful in daily activities and avoids, dislikes tasks. Hello.
Yes, sir. Audible, sir.
Yeah, fine. One sec. Okay. Okay, can you see the screen?
Yes, visible.
Fine. Okay.
Yes,
Right. So my dear friends, it was about inattention I was talking about. Let me go to the next slide, and that is about the hyperactivity or impulsivity. And as you all know, it's about the fidgets with or tap hands or feet, or as a squirrel squirms in the seat, leaves seat in situations when remaining seated is mandatory, or has difficulty in engaging in quiet or leisurely activities, is always on the go or acts as if they're driven by a motor. As somebody was saying like this, people who have a Ferrari brain with bicycle brakes, and that is about ADHD, always people says. Talks excessively, blurts or out answers. Has difficulty waiting their turn, even if they're standing in queue, definitely they has difficulty waiting their turn and always restless. Interrupts or intrudes on others, and nobody invite them for sleepovers. So my dear friends, it's about hyperactivity or impulsivity. But when we go for the diagnosis part, Based on symptoms, 3 kinds of presentations we know. That is about the ADHD. Everybody knows there is a combined presentation of inattention and hyperactivity or impulsivity, and predominantly inattentive presentations and predominantly hyperactive or impulsive presentation. So my dear friends, several inattentive or hyperactive symptoms were present before age 12 years, and several symptoms are present in 2 or more settings, and that is maybe at home, maybe at a school, maybe at work, with friends or relatives in other activities. So there is a clear evidence, there should be clear evidence of this guy is getting in some other places or socially or at the schools or one work functioning. In some other places also they should get this kind of a symptom. Then only we may go for this kind of a diagnosis with all these kind of a clinical features. So dear friends, common ADHD symptoms, to make it very precise, in children taking a long time to complete the assignments, trouble staying on a task, and difficulty sitting still. And definitely when they become adults, trouble listening during conversations, becoming bored easily, and taking a long time to complete work-related tasks, to make it very short. So dear friends, these are the common ADHD symptoms. But it is not only for kids, as I said earlier. ADHD is hard enough when you are a kid in the classroom, but as an adult, it can be little harder. ADHD is hard enough when you are a kid in a classroom, but as an adult, it can be harder. As the age progresses, symptoms of difficulty with executive functioning, and that is one of the most important problems, especially with disorganization, forgetfulness, chaotic work or home environment, poor planning, and poor prioritizing. To be diagnosed as ADHD, an adult must have a persistent current symptoms that date back into childhood. So it continues as problems into adulthood for half of their children, half of the childhood. So most of the important thing is disorganization or forgetfulness, home environment, and prioritizing can be a greatest problem when they come up in as the age progress. So can be prevented. The reason researchers say that even the gut is really connected to the brain like anything. So the gut microbes have a great role in this of ADHD. So can be prevented. The diet, the good prenatal care, behavior management, and parenting care having a great role in preventing the ADHD. My dear friends, what we can do? Prognosis depends upon the degree of disability, the child coming up, the type and severity of associated disorders, whether the intervention started early or the effectiveness of intervention. I'm not detailing much about it, but we know the prognosis depends upon what kind of a child is coming to your clinic and whether the intervention started and the effectiveness of intervention. In the psychology test, in that part, definitely the personality and the problem-solving styles, and in the current fears and the concerns about the patient, it's about the intellectual functioning, and definitely most of the ADHD children, they are highly intellectuals, and continuous sustained performance measures and the executive function. So these are the few psychological tests they are always go for. They always ask the questions which are relating to all these things, and which is more important, that is always about the management. We know the pandemic causing havoc for the kids with hyperactivity. In the recent newspapers, these were the greatest news, that is pandemic causing havoc for kids with ADHD, because they are always sitting inside a room, inside a flat, inside an apartment or house. They are not supposed to go outside, especially in the containment zone. So in the management part, one of the most important thing as a homeopathic doctor, let me first initially touch upon the homeopathic management. If you want to get the better results and the best results, one of the most important thing you have to keep in our mind is always we have to go for the constitutional treatment, because as a person who's coming out with from the Father Muller's Homeopathic Medical College, if you want to get the best result, it is always the constitutional medicine. But with that, as this child are brought into your clinic from school, the parents are coming to your clinic, they want to hear a lot about how to manage it. We know as a doctor how we are going to manage it, but parents think that 80% general management and 20% homeopathy will do the work. But we know that 80% homeopathy and 20% of the general management work with the results. I make it very clear. It is always 80-20 matter. It is always patients think that after getting a good result, they think that the management is always working together. But let me tell you, the homeopathy works like anything. 80% homeopathy constitution medicine works very well. And that is why I'm telling, we know that 80% homeopathy works very well and 20% the general management. Let me start with the general management, the guidelines for parents, teachers, and child training in right. Because homeopathic management, everybody knows like anything. Let me start with the punishment is not the solution, because this is attention deficit hyperactivity disorder. Just like any disorder, this is also a disorder. Punishment is not a solution for it. We can give positive punishments. Everybody knows what is a positive punishment. When they are doing some kind of a naughty thing, we can tell we're going to cancel a Baskin and Robbins ice cream. Okay, that gives some kind of a trouble, or they may be a little sad for some time, and there are every chance of correction from their side. Or if we are canceling an outing, or if you are canceling a movie, that can cause some kind of a sadness in their mind, and that can create a positive punishment. But my dear friends, punishment with a cane or beating, it is not going to give you a solution, because one-time punishment, one-time beating, it is not going to be a solution, because that is going to create a temporary pain. It is not going to be a permanent solution. So punishment is not a solution. Let me start with the guideline for parents. Number one thing is always, greatest complaint from parents is always, the kids are not listening to us. I always tell the parents that it is not that the kids are not listening to you, but the greatest thing is the kids are always watching you. My dear friends, be a role model. We have to tell our parents that we should be, the parents should be a great role model. Number one thing is be a role model. That is number one. Number two is always child imitates you. For a given situation, how you are going to respond for it. If there is a trouble, if there is a problem with your family, inside your family, if there is a great problem, how the parent is going to respond at that time. Are you responding at that situation, or are you reacting in that situation? The response is positive, but reaction is negative. If you are reacting in that situation, the guy in your house, the child in your house, what he may be thinking that every time when there is a negative situation, you have to react for it. So the child imitates you, and literally he is going to photocopy you. He is going to make a Xerox out of you. He is going to imitate you. Accept your child. Accept your child means nothing but he may be having positives and negatives. Whatever it is, accept your child, because that is your child. Have realistic expectations. We know that all the people who are around us, they may be growing and glowing like anything. You should have a realistic expectation about your kid, because that is your kid. And maintain calm and a conducive environment. Inside your house, it should be happy, and you should be calm and relaxed. Formulate a regular routine for this kind of kids, because they are like a broken spring. And so it is always make a regular routine, systematic, getting up time, sleeping time, for your dinner, for your lunch, for your breakfast, for everything there should be a regular routines. Give time for relaxation and fun. It is always inside the house, there should be fun time. You can go outside. At that time also, you should have some kind of relaxation and fun. Positively reinforce good behaviors. Every time you should be able to motivate, you should be able to pat on the shoulders of your kids. You should be able to tell all these things to your parents. You should be able to communicate all these things with your parents. The greatest thing, most of the time when the parents, they are coming to our clinic, almost all the homeopaths are good in talking, good in communicating. When they go to the other places, what happens? These people always say that most of the doctors, they are not ready to interact or communicate. And the greatest thing with homeopaths, we always good in interaction. So it is always positively reinforce good behavior. We have to talk and communicate with the patients. Ignore unimportant irritations from your child. Tap their creativities and abilities. Tap their creativity. Everyone are blessed with something. They may be good in something, and always tap their creativity. They are maybe good in anything. And abilities, what are their abilities? Find their abilities. They may be good in one or other thing. Avoid comparison. As I said, they are blessed with something. Don't compare your child with the neighborhood child. Collaborate with teachers. That teachers are your friends. Teachers should be your friends. Don't tell negatives about the teachers. You should be able to tell that to your parents. Be attentive with firmness. You are supposed to tell your parents, the kids' parents, that you should be attentive with firmness. And these are the few guidelines, because the time doesn't permit. I don't want to elaborate on it. Guidelines for the parents. If it is so, these are the few things I want to tell about the teachers. When the teachers are referring, and if you're lucky enough to go to the schools, and if you're lucky enough to go to be interact with the teachers, always tell teachers, be firm, but be flexible and inspiring. Definitely, if you're an inspiring teacher, definitely the students, what kind of a teacher, what kind of a student, even if the student is a bit naughty also, they love the teacher. You should have a welcoming classroom environment. You should have a welcoming classroom environment. That means the teacher should have a smiling face, first of all. And if a child does something, a very good thing in the classroom, appreciate publicly. Everybody likes appreciation. I like to appreciate Dr. Dheeraj for something. He was continuously back of me for hosting this kind of a program. And I should, everybody please put in the chat box and give an appreciation to Dr. Dheeraj for hosting this kind of a program in this ProVision. Please appreciate, please put a word appreciate in the chat box right now, because appreciation everybody likes. Let me see in the chat box. Please put appreciate in, please put the word appreciate in the word for Dheeraj in the chat box right now. Please, my dear friends, please put the word appreciate for Dheeraj right now, because he was helping me like nothing. Because appreciating publicly, everyone likes it, right? So Dheeraj, congratulations, and thanks for helping me like anything. Appreciate publicly. Always, if you want to criticize someone, definitely criticize privately. Definitely when you're talking with teachers and even with the parents, tell them criticize privately. Observe and listen. The teachers, you have to keep in your mind, always observe and listen. One thing, and let me tell you, in every talks about hyperactivity, every talks about this. I heard from lots of talks that is if somebody is hyperactive, you have to make that child sit in the first bench. But I totally disagree with that. Just because of one reason, if we make that child to sit in the first bench, he is something different from other children. And he may be thinking that I am something different, and that makes that child indifferent from other children. Even I used to take so many classes for the students also. So that is my experience. If you make that child different, that child will become indifferent too much. So don't make that child different, but you observe and listen to that child, and you can make that child exceptionally good. That is my experience. My dear friends, today I'm really happy today, because today is 13th of July 2020. Today 3 o'clock, the results of 12th standard came today. And I became very happy today because I got 100% results. Because 12th standard, we got amazing results. So many of my students, when I say, because I'm giving medicines for so many students who are hyperactive in the 12th standard, and we got good results. Everybody passed, first of all, and everybody passed, and everybody with our homeopathic medicines passed. And I'm really happy. This is a great evening for me, because since 3 o'clock, 3 o'clock today, I got lots of calls from many schools, from lots of management, and especially from parents. So my dear friends, one of the most important thing is always observe and listen. Be friendly and influential for teachers, and go for experiential learning. I don't know whether doctors know anything about experiential learning. Experiential learning is nothing but learning by doing it by yourself. The people with hyperactivity, they always love learning by doing it by yourself. That is experiential learning. Instruct in short, simple steps. They doesn't like to sit for a long time. So it is always in short, simple steps. Frequent rest and rewards. They have short attention span. So after 15 or 20 minutes, give them rest. And if they do well, reward them. As I told about our Dheeraj, it is always about give rewards for everyone. and structured assignments. My dear friend, these are all for the teachers. Coming to one of the most interesting things, it is always about the child training. And coming to the last few minutes, it is always pills don't teach skills, but we have to educate the parents to teach some skills for our students or kids or children, the patients who are coming to our clinic. Number one is always self-analysis. That is about the problematic children who are coming to our clinic. We should be able to convince them that they are good, they are amazing, they are awesome. They should go for a self-analysis. They should be going with self-rewarding, with self-affirmations. Self-affirmations is nothing but I'm good, I'm fantastic, I'm fantabulous. And that kind of affirmations will help them like anything. Encourage sports and dance. I am working with Father Wilson. He was a principal for 12 years at Christ School. I am working with him for a research about, he is doing his PhD, research about ADHD and sports. And my dear friends, my experiences, sports and ADHD works together like anything. And we get amazing results with medicine, with homeopathic medicine and sports, we get amazing results. And with that, sports and dance, we get again fantastic results. Develop hobbies. With hobbies, you let them master musical instruments. And musical instruments means nothing. It's very simple. The number one musical instrument I always suggest is keyboard. You may be knowing Stephen Devasi from Kerala, and the person who taught Stephen Devasi is Father Thomas, a good friend of mine, Father Thomas. Once he said like this, when we study keyboard, that is organ or keyboard, when we play that, we use all the fingers. And when we use the fingers, definitely all the tips of fingers, when we give the pressure with the fingers, definitely what is going to happen, that is give a stimulus to our brain. That makes us relaxed. Master musical instrument, number one, keyboard. Number two is guitar, using your two hands. And the third one is always drums or jazz. So you can use any musical instruments. These three instruments I always suggest. Encourage friendships. Let them go with the friends and then enjoy their life. Teach social skills and values. Move with other people and teach social skills and values. And values is one of the most important thing. I already mentioned it. Educate money management, because money management is one of the most important thing. You just think right now, do you know what was the expense in the month of June, last month? What was the expense at your house, in your house itself? What was the expense in the month of June? You think about it. What was the expense? Educate money management for your own kids, first of all. Then you can teach to your kids. Educate money management. Build child's strength. Earlier I mentioned about it. Give responsibilities of cleaning inside your house. Give responsibility to clean outside the house. They always love it. And give lots of responsibilities. Train in reading and writing. You may be knowing a system called STEM. STEM is nothing but, it is all science, technology, engineering, and mathematics. STEM system of studies. It is an international acclaimed system. STEM, science, technology, engineering, mathematics. Now they changed it into STEAM, and that is, STEAM is nothing but science, technology, engineering, arts, and mathematics. Science, technology, engineering, arts, and mathematics. They put arts into it because arts is always necessary for the development of brain of children. But again, recently, within the last few months, again they changed for something more, and that is science, technology, reading, engineering, and arts and mathematics. That is STREAM. Science, technology, reading, engineering, arts and mathematics, STREAM. And that is the latest one, STREAM. That is why I have gone for this point, training in reading and writing. As time doesn't permit me, train in reading and writing. Educate physical health and exercise. Lots of physical health we have to keep in our mind, and lots of exercise. I'm not going to mention about it, but exercise is one of the most important. Awareness of what on diet, I'm going to that point the next. General knowledge is one of the most important thing, and one of the most important, another one is wise use of technology. Recently, last week, one boy came to me who's studying for third year engineering, a person with 5 marks hyperactivity, a person went for ganja, all for drugs and everything. When he came, I simply asked him, what for you are studying third year engineering? Computer science student. I simply asked him, What all things you know about technology? I simply asked him about so many things: augmented reality, artificial engineering, IoT, Internet of Things, blockchain, everything. But he doesn't know anything about it. He knows it one sentence, two sentence answers for it. My dear friends, that is, he failed in so many subjects. He's not studying anything. He knows only one thing about technology, that is PUBG. And dear friends, wise use of technology and general knowledge. So in child training, one of the most important aspects I want to tell you is always increase dopamine produced through exercise can help improve attention and focus. More than basketball, more than football and every games, skating is one of the most important things. Cycling is one of the most important things. And one thing I love is always swimming. Swimming, organized sports and physical activities can help them get their energy out in a healthy way and focus their attention on specific movements and gross motor skills. Motor skills should be improved, and that is the most important thing. So I always suggest, and suggestion is very simple, always go for the skating, roller skating. Another one is one of the most important thing is cycling, and swimming is one of the most important thing, because all these things will help them to improve their happy hormones. You know, that is dopamine, oxytocin, serotonin, and endorphins, and this will be improving. As aggressiveness and arrogance will come down, they will be more happy. And with that, few more things to add up with. Hopscotch is another beautiful game you can give to improve this kind of gross motor skills. With that, you have to improve the fine motor skills also. To improve the fine motor skills, definitely the origami. You can ask them to make paper balls, and that kind of, you can see in the screen itself, lots of bait with the bird and all this kind of thing, origami. You can make even Gandhi's picture, you can see. Make scrapbook, let them paint with fingers. Puzzles is a beautiful thing. Play piano, earlier I said. Building blocks and play with rice and gems. And play rice means nothing but you can put rice in a bucket in a bucket or something, and you can put a pin or something inside it, and you can ask your kids to get that from that bucket, and by closing their eyes, that kind of a game. Or you can make them to pick gems, small gems from it. So this kind of exercise, water dropper game, doll dressing a doll, learning to brush, jewelry making with beads, play with dough or clay, playing with rubber bands, sand playing, cutting with scissors, thread objects on strings, drawing, coloring, painting, sort and stack coins into piles, or walk between lines. My dear friends, these are all fine motor skills. Dear friends, all these things will improve the motor or fine motor skills. You may be thinking that I didn't touch anything about homeopathy, but all these things may be interesting for the parents. If you are talking all these things about all this improving the fine motor skills and another things, definitely the parents will be very happy, teachers will be very happy, and the patients will be pouring into your clinic. And another one of the most important thing is about the diet. We know that 70% of your brain is water. Definitely we have to drink water, have fibrous vegetarian food, fruits, and avoid junk foods. Avoid sugar cakes, cookies, and pastries and ice creams. Avoid artificial colors, flavors, and preservatives. Avoid spices, sauces, pickles, jams, and vinegar. Everybody knows it. Avoid preserved and frozen foods. Avoid carbonated and caffeine drinks. And dear friends, one of the most important thing, again, I said it's about the homeopathic management. We always go for the constitution medicine. This is the last part. And with the constitution medicine, as I said earlier, constitution medicine, initially when they come to our clinic, they might have gone for many other doctors earlier. They might have gone for other systems of medicine. They might have gone for other treatments. And after all the other treatments, they may be coming to our clinic. So initially, we have to show the results. So initially, if you want to show the results, definitely, if you are that confident with our constitution medicine, we can start with the constitution medicine. But initially, they may be a little hyperactive in the starting itself. And they may be, if they are highly hyperactive, if you want to start with some acutes, you can start with some medicines. So I went for some 10 medicines here, and that are my few suggestions over here. That is Ethusa, you know all these medicines: Ethusa, Chamomilla, Sina, Hepasul, Phioseamus, Lycor, Naxomica, Tarantula, Tuberculinum, Veratramel, and you know that is my time is already set. It is always, I have gone for some kind of symptoms are also here. And rubrics are here. It's always this a kind of medicines are indicated as kind of indicated medicines. I have gone for few medicines indications are here. So my dear friends, my experience with homeopathy, they can change. Definitely the hyperactive children can change like anything. The excess energy can be changed into enthusiasm to a positive thing, and impulsivity can be changed into spontaneity. And if we are giving with 100% confidence, as I said earlier, patients think that 80% general management and 20% homeopathy wins. But we know that from base of our heart, we know that 80% homeopathy wins and 20% general management work. So it is always excess energy to enthusiasm we can change, and impulsivity to spontaneity we can change. And definitely David Neilman or Michael Phelps and Adam and Bill Gates and another person in the middle, the next patient ADHD, we can bring out wonderful results. So my dear friends, thanks to Father Muller's entire team of Father Muller's, thanks for inviting me to be here. I shared few of my simple experience in the last few years, my experience with ADHD, simple experience. I know every doctors have lots of experience with ADHD. Everybody are treating ADHD with a simple knowledge. So my dear friends, everyone have lots of experience in this world of ADHD. Dear friends, thank you one and all, especially Dr. Prabhukiran, and let me thank Dr. Srinath Rao for his humble words, for inviting me to this into this Father Muller's again. Let me thank again Dr. Siju Prasad sir, the principal of FMHMC, for inviting me for this fabulous program, ProVision, and my good friend Dr. Girish Navada again for inviting for this Mission Possible program. Thank you one and all for inviting for this program, and all the participants, all the awesome homeopaths. Again, thank you one and all. Thank you everyone.
Thank you, Dr. Siju Thomas. Now I invite participants, after having listened to a wonderful session, to type their queries in the chat box so that Dr. Siju Thomas can address to them. Participants are welcome to type their queries in the chat box. There is a question from Dr. Meghna. Can there be OCD associated with ADHD?
Okay, about obsessive compulsive disorders, definitely. Yes, sometimes I'm getting some kind of students I'm getting, especially senior students having obsessive compulsive disorders. They'll be having, definitely we are getting some kind of symptoms. So when we are getting some associated symptoms, we have to treat in that kind of a thing. So definitely when ADHD, definitely it can come with ADHD, OCD also can come up with that kind of symptoms are there. So when we are giving the medicine, when we are prescribing the medicines, we have to keep that in our mind. We have to keep that in our mind, and when while we are prescribing that, only that much. Prabhukiran sir, can you speak loudly? I'm not hearing you.
Yeah. Vidhi Tushan is asking your any experience regarding role of restlessness remedies like arsenic album, aconite, and rustox in ADHD.
Arsenic album, okay, definitely we studied earlier in the first year itself about all these medicines, isn't it? But when we are in the clinic, it is not only the arsenic, aconite, or rustox or this kind of a medicine which is coming up, but definitely we go for, especially I go for the constitution medicine. So when I go for initially for the constitution medicine, I always study their totality, and especially there may be some kind of the history from the family also, and I always study in that aspect. And rarely these medicines comes up in the treating the hyperactivity. I said earlier, some medicines like Naxomica or Natramur or Lyco or even Anacadium or Staphysaccharine or Stramonium or this kind of medicines usually come, and even Ethusa or Silesia, this kind of medicines usually come. Rarely for, just by looking into the restlessness, we can't give the medicines. Not only for one symptom, we are giving the medicine. Sir, please.
Dr. Payal Israni is asking your tips for parents who get irritated managing their ADHD child. Parents will get irritated.
First thing is we have to give medicine for the parent, I feel. Because we are not supposed to get the irritability for the parent, number one. Because the first thing is, as I told earlier, the first thing they are going to copy is their parents, isn't it? So number one thing is parents are supposed to get irritated, number one. We have to convince the parents this is not the naughtiness. They are not showing off. The child is not showing off, number one. This is a disorder. Attention deficit hyperactivity disorder is a disorder, number one. So that is number one we have to convince. I was talking more about the management side just because of this reason only. I have taken this kind of ADHD classes before also for the medical fraternity of other systems also. So this is my experience. When we talk about the pharmaceutical side or the therapeutic side, why I concentrate more on the other management just because of one reason. We have to convince the parents about this disease, about hyperactivity. I have gone for so many parenting workshops, more than about 1,500 parenting workshops. Everywhere this question comes up, how we have to handle it. First thing is they have to handle their aggressiveness and arrogance. So we have to, that is why I told we have to treat the parents first of all. Yes, sir. Any more questions? Hello.
Sir.
Yes. Any more question?
No, sir.
Okay. Fine.
Yes, sir.
I think
Sir, we have,
Counseling.
sir, before ending, we have a small question, a last question. What about role of counseling?
Yes,
A last question.
Yes, counseling. Okay,
Yeah.
it is not only the counseling we have to give. Counseling is very important, but in the initial part, counseling won't work, I will say, because initial part, firstly, the patient won't be able to sit in our clinic and listen patiently. They are not ready to sit patiently before us because of their hyperactive. They are not ready to listen to our words. So, but we are supposed to make a rapport with them initially. We are supposed to make a rapport with them. We have to start the medicines, and with that, with medicine, with counseling, but the very word counseling itself is a confusion for the patients and their people who are coming with them. So instead of counseling, I always use the word guidance. I never use the word counseling, because when we say counseling, the word counseling itself is a confusion for the parents and especially the patient itself. When they are coming for the counseling, what they say is, I don't have any mental problems. So I don't want to hear that kind of a mental problems. They will say like that. So the best thing is always the initial first consultation. We talk to them. We don't give any advices or suggestions. Like, we always listen to them. We take the case. And in my clinic, I always take the case, a detailed case taking. And like that, in the second or third, they will ask us, sir, can we go for a counseling? At that time, we go for a detailed thing. Second consultation or third consultation, we go for much time and we go for counseling like thing. So it is always, that is the best thing I always suggest. In the first itself, if you are going for, I'm going to counsel you, that kind of a sentence will make some kind of a problems and create some kind of a problems for many. Because as I said earlier, the parents are coming with a big question, $1 million question, whether my child is having a mental disorder. Because that is what from many of the schools are sending with that kind of a thing. You go to a psychiatrist or a psychologist. So with that kind of a words, if they're coming to us, that can create some kind of bitter questions.
Thank you, Dr. Siju Thomas, for sharing all the experiences. Over
Thank you,
to
sir.
Dr. Rachel.
Thank you, sir. I think we all can agree with me that today's session was presented in the most explicit way. Sir has enriched our knowledge, not only medical knowledge on ADHD, but also definitely our general knowledge. Sir, once again from the Mullerian family, a big thank you for accepting our invite and presenting today.
Thank you. Thank you.
Thank you, sir. I would also like to thank our moderator for today and our Vice Principal, Dr. E.S.J. Prabhukiran. Thank you, sir. On this occasion, I would also like to thank our principal and administrator for their constant support in the webinar series. A big thank you to the webinar organizing team under the leadership of Dr. Dheeraj for organizing these events smoothly. And last but not the least, a big thank you to all our dear delegates for attending these series in large numbers. Tomorrow we have another seminar by Dr. Mansoor Ali on the topic dermatology in practice. So hope to see you all tomorrow also. Thank you and have a pleasant evening ahead. Thank you all.
Thank you.